Hello everyone, I'm Dr. Rwituja Thomas Grover, a consultant oculoplastic surgeon at Vision Eye Centers in New Delhi. So basically, we will be covering the common oculoplasty procedures in a sort of series so that, everybody knows and gets to know gradually about these procedures. But firstly, who is an oculoplastic surgeon? So, an oculoplastic surgeon is basically an ophthalmologist, that is an eye doctor, who has specialized in the plastic surgery or the ophthalmic plastic surgery around the eye. So, we mainly deal with issues related to eyelids, related to the water duct, that is the pathway of water that exits the eye. So that is the lacrimal surgeries. We deal with orbit surgeries, that is the bone which surrounds the eye. If there are any fractures in there, or if there are any tumors behind the eye, we deal with that. And also, to an extent, oculofacial aesthetics. So these are procedures to sort of enhance the appearance. So that is botulinum toxin injections, filler injections, blepharoplasty, these kind of procedures. So this is mainly the work of an oculoplastic surgeon. Now, within this, what we'll discuss today is a very common oculoplastic condition, that is ptosis. So ptosis refers to the drooping of the eye. So when one eyelid is a little lower than the other, or even if both the eyelids are lower than what normally it should be, that is what we call as ptosis. So what is the cause of ptosis? So ptosis can be present either in children or in adults. So there are different causes for this. In children, it could be that it's present since birth. So it's basically something which parents notice as the child is born right away. So that is something which is present congenitally. It can also be that the child has some neurological issue because of which there is a drooping of the eyelid, that is third nerve palsy, that can also be present in childhood. And the other thing, although rare, are tumors or neuromuscular conditions which can cause. So these things have to be diagnosed by an ophthalmologist or an oculoplastic surgeon. Eventually, these cases are referred to an oculoplastic surgeon. Now, with respect to adults, age can sometimes cause ptosis. So either it could be because of the weakening of the muscle in the eyelid. So sometimes, very rarely, chronic rubbing of the eyes, possibly because of allergic conjunctivitis, or wearing contact lenses over long periods of time. Sometimes even just sleeping on one side continuously can cause the drooping of the eyelid. So that is because of the weakening of the eyelid muscle. Again, adults can also have the neurological condition, that is the third nerve paresis or oculomotor nerve palsy. So in this, again, there would be drooping in some conditions, and it will be associated with certain other features which I will discuss. Also, there is a condition called myasthenia gravis, which is a neuromuscular disorder wherein the person can either have an isolated drooping of the eyelids, or drooping of only one eyelid, or have weakness throughout the body. So like difficulty in swallowing, or difficulty in breathing at times towards the end of the day. So these are conditions which need to be managed along with a neurologist, not just an oculoplastic surgeon or an ophthalmologist. The other thing is that there could be masses or tumors in the upper part of the eyelid, which could be dragging the eyelid down and causing mechanical ptosis, or tumors within the orbit in the upper part, which can sort of mimic a ptosis. So these need to be ruled out again. Now, what are the sort of symptoms that come along with ptosis? That is, other than the drooping, what are the signs and symptoms that can accompany this drooping? So one would be that in children, they may have an abnormal head posture. That is, if the eyelid is down, they might raise their head and look like that. So that could also cause changes in the neck as well. So that is one thing. Because of the chronically drooped eyelid, they may have issues with the visual development. So the vision may be reduced in the eye, which is sort of covered because there's not enough visual signal going to the brain. So in that case, the vision might be affected in that particular eye. So the vision has to be checked definitely. In adults, the symptoms could be that along with the, if they have ptosis, they could be having double vision. So if there is double vision, the third nerve paresis, that is, the nerve also affects the movement of the eyeball. So this has to be checked as well. If the movement of the eyeball is affected, then there could be a nerve paresis or a neuromuscular condition, as I mentioned earlier, like myasthenia gravis. So if there is double vision along with the drooping, that is when the drooping doesn't cover the eye fully, the you can still see through the drooping, and there is double vision, you need to rule out neurological or neuromuscular conditions. With respect to what we do after we diagnose, so usually if it is a simple condition like a congenital ptosis or a senile ptosis, that is age-related ptosis, or a ptosis because of rubbing or contact lenses, this is basically treated directly. Once the surgeon diagnoses it, it's treated directly by surgery. So your surgeon would advise you surgery for that. The other thing is, suppose there is a movement disorder, that is, like I mentioned, the double vision. Sometimes children may not have double vision but still have a movement disorder in the eye, that is sometimes referred to as monocular elevation deficiency. So there is a drooping, but that is mainly because the eyeball is also squinting. So that has to be treated. The squint has to be operated first, and then sometimes the ptosis sort of, or pseudotosis as we call it, that can resolve by itself or has to be treated later by surgery. So this has to be checked. Now, if the adult has double vision and the weakness, like I mentioned, the double vision increasing during the daytime, then you would need to do certain blood tests for the myasthenia. So myasthenia gravis can be diagnosed by blood tests, and then after it is diagnosed, it needs to be treated. So blood tests, certain nerve conduction studies, these things are done prior to starting any medication for myasthenia. So the drooping in myasthenia can sort of dramatically improve once you start medications. So the neurologist would start those relevant medications. However, if over a long period of time there is drooping, sometimes it doesn't improve completely just with the medication. There is a mechanical component also, and that might require surgery. There are other slightly rarer conditions that may manifest in adults and would have started in childhood, like congenital fibrosis of the muscles, or progressive ophthalmoplegia. So in these conditions, these are sort of easily picked up by ophthalmologists and oculoplastic surgeons. So this has to be diagnosed, and then the condition is treated accordingly. Sometimes the surgeon may not want to lift the eyelid completely. So these things have to be sort of checked by the surgeon before sort of treating. The other thing is, if you are suspecting that there could be a mass of some sort or some other issue, neurological condition for which you need to rule out anything in the brain or in the orbit, that is, this area needs to be imaged, then your surgeon might do a CT scan or an MRI to make sure that there is no issue in the orbital region or in the brain which needs to be diagnosed. So this is about the tests which may be done with respect to the diagnosis of ptosis. Now, with respect to treatment, so before you sort of go ahead and do the surgery, certain blood tests are advised by our surgical counselor, who reviews the blood tests and discusses it with our anesthetist, especially if the patient has to be operated under general anesthesia, in younger children especially. In the older individuals, we can operate under local anesthesia. That is, initially we put a numbing cream on the eyelid so that the skin becomes numb. And then after that, we put an injection through the numb skin. So the injection sort of makes the whole area numb so that there is no feeling of pain or discomfort during the surgery. During that procedure, the patient is completely awake. One issue that patients may develop after a surgical procedure for ptosis is that they have asymmetry on looking down. So while looking down, there may be one eyelid sort of hanging up like that, and that is a common issue after ptosis surgery, especially in more severe cases. So this has to be kept in mind, that the eyelid may hang up a little. So usually we tell patients who have this problem after surgery to look down, and then instead of looking down just directly, looking down with the head down, so that makes that difference less obvious. With respect to the types of surgery, so in children, there are grossly 3 types of procedures. For the mild ptosis, that is around 2 mm of difference, we do something called fascinella servat, wherein if the eyelid fold is present and the eyelid muscle is functioning well, we can do the surgery from the inner aspect of the eyelid. So there wouldn't be any scar in this procedure. However, there may be a stitch which requires to be removed by the surgeon after about 10 days or 2 weeks. In moderate ptosis, that is ptosis which is sort of in between, more than 2 millimeters, in that situation, we do something called a levator resection. So along the eyelid crease, the skin is opened on the eyelid, and we go inside, access the muscle which lifts the eyelid, and sort of tighten the muscle, so or reattach the muscle. So that procedure is basically involves a scar on the eyelid. However, the scar is masked within the eyelid crease. So the stitches again for that are removed within a week or so, and that scar kind of fades away and blends in with the eyelid crease, especially if a new crease is formed for the patient who doesn't really have a very clear crease. The third procedure is the frontalis procedures. So frontalis is basically the muscle in this area, so the muscle which elevates the brow. We use this muscle when the eyelid muscle doesn't function well. So this muscle is sort of used to elevate the eyelid by this sort of elevation of the eyebrow. Now, how do we connect this muscle to the eyelid? So one of the procedures is called silicone or silastic sling. So a silicone band is passed like this through the inner aspect. So under the eyebrow, in the forehead, through here, by 3 incisions in this area. So there are cuts made here, very tiny cuts in the eyelid, and a silicone band is passed in the inner aspect, and it is tied here. So that this movement is used to sort of lift the eyelid. Now, with respect to the scars after this procedure, in the eyelid, of course, there's nothing much to worry about. There may be some fullness in this upper lid region, some fullness might develop. However, in this area, there will be 3 small cuts. The cuts, if made by a skilled surgeon and somebody who performs the procedure often, these cuts don't really leave much of a scar behind. They are sort of just a faint line by the end of it. So that's nothing to worry about. The other procedure which can be done in children above 4 years of age, from the thigh area, there is a tissue which covers the thigh muscle. So that tissue is called fascia lata. So the fascia lata is taken out by the same surgeon, by the oculoplastic surgeon itself, by a small incision roughly of this size. And that is used to make those bands similar to the silicone, that is the artificial material. However, this is the same material that is in the same patient's body. So that is made into strips, and the same procedure is done along this area itself. So usually this procedure is done when there is bilateral or both eyes ptosis. So when there's drooping on both the sides, this procedure sort of works well to give long lasting results, because with the silicone sling you may need revision procedures over the years to tighten the sling or replace the sling, because the sling silicone band tends to stretch over time. So this is a slightly more long lasting procedure and especially helpful in conditions where there is both eyes drooping, and it gives good cosmetic results. The other procedure is the frontalis flap procedure, wherein through this eyelid crease incision, which we were making for the eyelid muscle surgery in moderate ptosis, through this same crease, this muscle is mobilized. So from here, this muscle is sort of pulled down and attached to the eyelid. So that again works in a similar way to keep the eyelid elevated. So that's the other option. Now, these same options apply to adults as well. In adults, however, the procedure which is done for mild ptosis from the inner aspect, prior to doing that procedure, we do something called a phenylephrine test, wherein a drop is applied in the eye to make sure that the eyelid is going up and the ptosis gets corrected with the drop. So that means that particular muscle, or the Mueller's muscle, which is accessed from the inner aspect of the eyelid at the time of surgery, if that muscle functions well with the test that we do prior to surgery, then it means that after surgery, tightening that muscle, the patient will get a good result. So the advantage is that there is no scar. The stitches are present in the inner aspect, which are removed, and it gives a good and predictable correction as well as contour of the eyelid. So contour is something that we sort of have to create to match the other eye. So in this, there is not much of deviation with respect to the shape or the contour of the eyelid. Again, the levator surgery is used to mainly reattach the levator muscle, that is the muscle which present within the eyelid, which lifts the eyelid. That is again done in adults, and again it is a procedure which sort of has good results. The scar is hidden within the muscle, within the crease of the eyelid, and we remove stitches after a week. Even in adults, the frontalis sling or the bilateral surgery, that is the fascia lata surgery, helps if there is a poor function of the levator muscle. Even frontalis flap surgery can be done for this. So these are the 3 gross types of surgeries for different kinds of ptosis. Now, this sort of choice or choosing the procedure, it's not up to the patient. Usually it is up to the surgeon, because there are sort of clear guidelines as to what procedure needs to be done for what grade of ptosis, or the measurements sort of decide what kind of ptosis is required, or how prominent the lid crease is, how the muscle is functioning. This is what helps to decide what procedure has to be done. So some of the issues which can happen after surgery: overcorrection, undercorrection, dryness of the eye. So these things have to be tackled by the surgeon. So sometimes the surgeon would choose to operate again within a week or within a month to recorrect, the under or overcorrection. In case the eyeball doesn't function well, that is, the eyeball movement is not adequate, the patient may develop some dryness. So that is sort of combated, especially in congenital ptosis, by putting a stitch on the lower lid at the end of surgery. So there is sort of a string kind of hanging from the lower lid that is pulled up and taped to this area. So from the lower lid, it is pulled up and taped to this area, because in the initial 1 week, the closure might be very poor with respect to the upper lid coming down and closing the eye. So this can cause dryness. To prevent that dryness, we lift this eyelid and tape it here, especially during the night time when the patient doesn't realize if the eye is open or not. We advise drops, gels, and things like that to keep the eyes moisturized and lubricated. We advise ointment, antibiotic ointment over the stitches, and along with that, tablets like antibiotics and sometimes oral steroids to reduce the inflammation and prevent infection. So this is roughly about ptosis and the various types, causes, what kind of treatments are available, and of course some part of the post-operative management. The remaining sort of finer topics we'll cover as and when the questions are asked. So let's go ahead and pull up some questions so that we can see what people are concerned about with respect to ptosis. Right. So one question is that how do I know if I'm a good candidate for oculoplastic procedures? So in with respect to ptosis, that is, if you're a good candidate or not would be mainly decided by the surgeon. So suppose there is any sort of movement disorder, or anything which sort of makes surgery dangerous for you. That is, if we lift the eyelid and the eyeball doesn't roll up the way it is supposed to roll up and it doesn't move, you may get severe dryness. Sometimes if these procedures are performed in people in whom it shouldn't be performed, it can cause such severe dryness that even the cornea can become white. That is, the black part of the area can get spoiled because of this. So your surgeon is the one who knows the best if you're a good candidate or not, and the various tests that the surgeon would do basically helps to decide on whether they should operate you or not, especially if you've been operated multiple times, or if there is any particular issue which needs to be tackled. The surgeon would be the best person to decide. The other question is, okay, are there any specific pre-operative instructions that I need to follow before undergoing an oculoplastic procedure? So pre-operatively, of course, we need to see all your blood reports, especially the anesthetist needs to see them. And the basic thing is that after the procedure, for a week or until the stitches are removed, We would not be advising you to wash your hair because we don't want the eyelids to sort of get wet, or the sutures, the area with the incision, to get wet. So it would be better if you could take a proper head bath and a proper bath before surgery, because after that you'll have to sort of wet sponge your face, and you may not be able to take a bath right away. You can take bath below your neck immediately after surgery, but this area has to be wet sponged or cleaned with a wet towel, and the hair cannot be washed for a week's time. Another question: will I need to undergo any tests or evaluations prior to surgery, such as imaging or blood work? So that I have covered within our talk, and that is basically that yes, before the surgery you do require routine blood investigations, such as blood sugars, complete blood count, etc. And before deciding whether the patient needs surgery or not, to diagnose the patient, yes, you do need blood work sometimes. But as such, before the surgery, if there is just a simple ptosis and a surgery is planned, no, there is no imaging or scanning which is required at that time. Okay. Another question: will I have any visible scarring after the surgery? And if so, what can be done to minimize the appearance? Okay. So, like I mentioned, scarring is sort of masked within the eyelid fold if it's a skin approach surgery. And if it is a frontalis procedure, that is a silastic sling or a facial lata sling, there will be scarring here in this area, but I wouldn't call it scarring as such. It is just a incision which sort of heals with time, and the line which is left behind, it sort of keeps fading with time. So that is the basic thing. There are certain creams, etc., which are advised after the stitch is removed, which can sort of minimize its appearance and make it almost fade away completely. So that we would advise you based on how your wound healing is. Now, if you are somebody who has a tendency for hypertrophic scars, or scars healing in an abnormal way, or a keloidal tendency, in that case your surgeon would probably reevaluate the surgical plan based on the scarring. So on your body, in any other areas, if you have any scars, based on the appearance of these scars, the doctor would take an opinion or decision on how to go further with your surgery. Another question we have is: are there any lifestyle factors or medical conditions that could affect the success or the outcome of the procedure? So I would say the main issue is that if your wound healing is not good, yes, that can affect the success. So ideally, it's best to, before you undergo the procedure, stop smoking before maybe at least 4 weeks prior to surgery, and of course after the surgery, so that the wound healing is good and predictable. This is the one of the few things which can affect. Based on lifestyle factors, I would say having a good sort of nutrition and having a balanced diet, that always helps for better recovery and wound healing after the surgery, because then you're getting all the nutrients and vitamins that you need, so that the healing is again good and predictable. Okay. The next is: how long do I need to wait after the procedure before I can resume my daily activities and exercise routine? Okay, so this is a very commonly asked question, that is with respect to the exercise and can we go swimming, etc. So the swelling after the surgery takes about 2 to 3 weeks to sort of come down and sort of flatten out. So I would say waiting for at least 2 weeks before doing any heavy activities, such as a lot of running or weightlifting or swimming. Uh, these are things that you can sort of wait on. Any light meditation, stretching, uh, just a treadmill or just walking, that can be resumed within about 10 days to 2 weeks. But it's best to wait till your wound is completely healed before going ahead and going for swimming, etc. At least 2 weeks is a good time to wait before you resume any strenuous activities. Okay. The next question: are there any specific warning signs I should watch out for after the surgery, and when should I seek medical attention? Okay. Uh, so warning signs, as such, very rare for ptosis surgeries. But like I mentioned, if there is a lot of redness, or if you feel like the black part is sort of looking less black, and if you're having a lot of watering or a lot of pain, irritation of the eyes, then come back immediately, because in that case we need to sort of up your lubricants, or maybe even reverse the surgery so that the eyeball doesn't become dry. So that is something that would need immediate attention. But other than that, there aren't any other issues other than the swelling, uh, which sort of increases over the first 48 hours, and then it starts decreasing gradually. Usually on day one, that is the day after your surgery is done, we remove the patch that is put after the surgery. So in that case, once the patch is removed, you will basically be able to see the stitches which are on the upper lid, as well as in certain cases, whenever required, the stitch on the lower lid, which is sort of used to stretch the lower lid and close the eye. So this is what you would see. You may have little bit of blood spotting, like blood trickling from that area for a couple of days if there is a lot of swelling. But other than that, there's not much to sort of worry about. The first couple of days, there may be some amount of swelling and pain, but after that, that gradually reduces and feel much better after that. Okay. Uh, so the last question for today that we'll take is, do I need to wear any special garments or use any specific eye care products during the recovery period? So yes, there are specific eye care products like the lubricating eye drops, the gels which are put in the eye, the ointment which is put on the eyelid. These are the specific eye medications which are used. There are no garments or anything, but ideally when you go outdoors to avoid dust and things, it's better to just wear goggles. That is for 1 week after surgery or till the stitch is removed. With respect to resuming your makeup or your sort of facials or chemical peels or lasers, those kind of things, it's best to wait for the procedures as such for a month. Makeup and things you can resume within about 2 to 3 weeks. So that should be good enough for that. So that's all for the questions. And I hope that you've got a good overview and uh, a lot of questions answered with respect to, your ptosis queries. And if you have any doubts with respect to your eyelid position or any other oculoplastic condition that you might be suffering from, do pay a visit, and we'll help you get it diagnosed, help you decide on the best procedure that you would require. And the final message would be that if you have any issues, to consult your surgeon so that they can decide what's best for you. So we are at Vision Eye Centers, that is, we are located in South Delhi at Siri Fort Road and in West Delhi at West Patel Nagar. So you can visit us by taking an appointment. and we hope to see you with all your queries, and if you have any issues, we are most happy to help you.